Welcome to the Holyoke Community Forum. Together we can. Today, we will be going over our strategies and the things that we came up with as the Holyoke HCS Coalition. Um, and today, if you want to go, we're going to go over our quick agenda. Uh, but before we do that, I'm sorry. Together we can. Welcome. Uh, 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 I just want to read a quote that I thought was very fitting for this event and the way we've kind of been working in partnership together as a coalition. Alone, we can do so little, but together we can do so much, by Helen Keller. Yes. So we're going to be going over a quick overview of the healing community study and what that means to the community of Holyoke. Um, give some information and appeal to all of you and helping us spread the word. We're going to have a panelist presentation today and followed by some question and answers and how to stay connected and closing remarks afterwards. So forum notices, this session will be recorded and shared, so please mute yourselves all presentations during all presentations. Ask questions throughout the session. The more interactive, the better. Place your questions in the Q&A field at the bottom of your Zoom screen. Answers given in Q&A field and Q&A portion of the forum. Complete, if you can, please complete feedback form at the end and help us learn from this session and what was helpful to your work and improve on our future forums. First, I want to introduce myself. My name is Rafael Rodriguez. I'm sorry, I should have done that in the beginning. I am the Holyoke Community Coordinator, and I work for Western Mass Training Consortium. And on this call today in this forum, we have Amani Harris, Becky Smelser, who is our Community Data Manager, and Maria Quinn, who is Community Faculty and works at Holyoke Medical Center. And Amani Harris is a community engagement facilitator. First, we want to start by, why are we doing this, right? We want to recognize the impact of opioids on this country, but not alone in this country, but how it has impacted Holyoke, Mass. And as you can tell by the slide, over 2 million Americans have what they have called opiate use disorder, right? And every day, more than 130 people in the US die of an overdose attributed to heroin, fentanyl, or prescription opioids. Just to give a little context of what it means for Holyoke, in 2019, 16 opioid overdose deaths occurred to Holyoke residents, also the highest number ever recorded in the city.
questions at the end, Raphael, so we'll move on to Tammy at this point. Thank you.
Judge Hadley, my name is Tammy Kozik. I am the Director for the Center of Recovery and Support at the Holyoke Health Center. Go to the next slide. So we've been offering treatment for opioid use disorder since 2008. We have a team of nurses. We are a nurse-led program supporting around 280 patients at both of our sites in Holyoke and Chicopee Health Center, working on an integrated team of waivered providers, clinicians, recovery coaches, medical assistants, nurses. And we have grown our program quite significantly over the last few years in terms of trying to increase access to more patients. So we have been, through the HEAL program, we have been able to increase that even further. We received, as the anchor site of the HEAL study, we received funding support for nurse and provider time to increase availability and same-day access for appointments to patients. So people would be able to walk in and access treatment with us. People can come in, they do not have to be a patient of the Holyoke Health Center. They can come in for treatment and we can get them connected to care. We have Suboxone, Vivitrol, and an injectable medication, long-acting medication. And we offer all of these to folks. If they are looking for other kinds of treatment, such as methadone, we can connect them to our partners at BHN across the street. So we've been able to increase our access to patients coming in, and we do many intakes a week, getting people into care with us as fast as we possibly can, mostly on same day. We have an in-house pharmacy as well, and our pharmacists are very knowledgeable about the medication, and they're very supportive of patients and have a very harm reduction approach to supporting folks. Same thing for us too. We are a very harm reduction focused program. And we want to keep people in care. And we know that everybody is coming in at different stages of change. And we try to address people with where they're at and support them with what they need. And so it's been great to be able to offer this extra services to people. As Judge Hadley said, we also take same-day referrals for MOUD from the Holyoke District Court, and that's a part of the strategy that we're supporting. We're also working very closely, and you'll hear more about the BHN's methadone clinic, but we are working very closely with them as well by referring patients over there for treatment, as well as taking patients back to us who may need connection to more medical care. So that's been a very great collaboration to have to make sure that we can offer wraparound services for people. Our clinical pharmacist is also created syringe packaging to patient resources, are advertising Narcan. So people that are coming in and getting purchasing syringes will have information about Narcan availability. We're also increasing our promotion of Narcan within our pharmacy so that people know that we have it there. We have standing order, and you do not need a prescription in order to pick it up. Go to the next slide. Like I said, we have a nurse-led treatment model focused on building relationships and providing education, all from a harm reduction, stages of change point of view. And we also are integrated in a very large, so we can support people on all different levels, including integrated behavioral health clinicians and recovery coaches. And both of those roles are very integral to the success of our team and how well patients do. We are co-located in other departments to facilitate coordination of other care, including STI counseling and testing and treatment, HIV case management, hepatitis C treatment, PrEP, which is pre-exposure prophylaxis for HIV, and Narcan. All of these are available in the same space so that we can help make supported referrals to our participants so that they can gain access to those services as needed. We're also a part of a much larger Community Health Center, providing primary care, dental, pharmacy, and other supportive services. And we help people gain access to all of those services when they come in, and maybe access services with us initially for treatment for MOUD, and then we can get them connected to other services. So this is a little bit of our data. As of April 2021, there was 281 patients enrolled in our treatment, 272 maintained on Suboxone, 7 maintained on Vivitrol, and 2 maintained on Sublocade. And as of May, we've referred 9 patients from the Holyoke Health Center to the BHN City Clinic methadone program. Next slide. And that's all I have.
Okay, so if we could go to the BHN slide. Yep, thank you. So just a quick introduction. My name is Rose Evans, and I'm the Senior Vice President of Addiction and Recovery Services at Behavioral Health Network. And Behavioral Health Network is a large regional provider of comprehensive behavioral health services for adults, children, and families. We've been in the region for 83 plus years, providing a myriad of services across Berkshire, Franklin, Hampden, and Hampshire County. So more specific to this grant, we are thrilled to be part of this study and the integral work of the team on this Zoom, as well as other providers and stakeholders in the Holyoke community. Our primary goal and work with within the HEAL study is to address the gap and the barriers to individuals having access to methadone in the Holyoke proper area. So really what we as an agency were focusing on is bringing methadone to downtown Holyoke so that it's immediately accessible, so that folks are not having to take public transportation and figure out how to access methadone in an area that is difficult to get to in Holyoke or in the Springfield area. And also to supplement the services that we have been providing in the Holyoke community for many years through our Holyoke, the city clinic, and also to further develop and expand upon our relationship with the Holyoke Health Center. So really what we're looking at doing at our clinic, our methadone clinic in downtown Holyoke, which we opened up in March of 2021, is to provide enhanced addiction services for folks, not just through behavioral health, but through methadone, and also to provide primary care services in partnership with the Holyoke Health Center, and to then also wrap around behavioral health services through our city clinic and through integrated care management that we provide for right now over at the Holyoke Health Center. So we're really looking at trying at accomplishing having one person and one team, so that individuals aren't having to go to a variety of providers to receive services, but are in fact receiving comprehensive care as it relates to addiction treatment, primary care, behavioral health, and care management. And also we really wanted to address stigma, the stigma of not having access easily available for methadone. And we also want to make sure that we're providing all 3 options of approved OUD treatment in the Holyoke downtown area. So as of this point, we have 70 plus patients in downtown with our OTP clinic, which is very exciting. We have been open since March of 2021. And as I said, we started development for this clinic in September or October of 2020. And so this was on the fast track for development and opening, and we met all of those goals, and we're really proud as a team and to be part of this team with the fact that we've been able to bring this service into the Holyoke community. And we provide dosing hours 7 days a week, and then we have walk-in intakes 3 days a week. And we can get into more details through the question and answer period. And as Tammy was suggesting, we also cross-refer between Holyoke Health Center and BHN, and then between BHN and Holyoke Health Center. So if we have a patient that might be able to be more successful with a different type of a MAT protocol, then we would refer over to Holyoke Health Center. And or if an individual at Holyoke Health Center is on a protocol for MAT and they might be more successful on methadone, then we refer over. Same with the physicals. With methadone, it's highly regulated. It requires physicals on an annual basis. So working in partnership with the Holyoke Health Center, we're working on primary care and addressing the primary care needs of the individuals in our treatment. So that's just kind of a high level overview. We have a multidisciplinary treatment team that works with the individuals, which involves our medical director, our counselors, our nurses, where we are looking at how the patient is doing, what might be the best protocols, what adjustments need to be made. We would invite Holyoke Health Center to those meetings when there's a patient that we're discussing that might also be part of their treatment team with all appropriate releases of information in place. So as to have a seamless system of care. So that's kind of a high level overview. And if there are questions, we can certainly talk more about our services during the Q&A. I'm going to now introduce Maria Quinn from Holyoke Health Medical Center for her piece.
Thanks so much, Rose. I'm Maria Quinn. I'm a psychiatric nurse practitioner here at Holyoke Medical Center. I oversee our recovery support team, and I'm also fortunate enough to be a community faculty on the Healing Community Study. So today I'll be talking about what our intervention is, which is the addiction consult service. I'll talk about why we started the service, what we do, and how that's really contributing to our goal. So while Holyoke Medical Center isn't an acute addiction treatment facility, on a daily basis, we're treating individuals who come to our ED and inpatient medical or psychiatric units for issues that are either a result of their substance use, so things like overdose, infections related to IV drug use, suicidal ideation, things like that, or their substance use is impacting underlying medical issues. And several of these same individuals were also often leaving against medical advice for various reasons. One of them being that their withdrawal symptoms weren't being treated. And another common reason is that they felt they weren't being treated well. I think it's important to acknowledge this. This isn't talking badly about our system, but if you can't acknowledge when something isn't going well, then how are we going to actually be able to change it? So the need wasn't also evident in terms of people presenting for care, but also really in terms of our staff. Education about addiction wasn't being provided in nursing and medical schools the way we are starting to see it today. So we have all of these amazing experienced care providers, nurses, doctors, who are caring for patients but don't have all of the resources or tools needed to really do the work in terms of addiction. And with that came the need for standardized care, staff education, and essentially our team was born. And the reality really is that the services here should really be addressing the needs of the community that we're serving. So I've talked about, why a consult service. Let me really explain what we're actually doing and how it's contributing to our overall goal of decreasing opioid overdose deaths. How we came to be was actually pretty organic and really was building upon existing services and initiatives that we've been working on here, including our own outpatient substance use disorder treatment office, the Comprehensive Care Center. Over the last 2 years, we've really focused on addressing substance use disorders, in particular opioid use disorder in our emergency department, with starting people on buprenorphine when appropriate and increasing overall supports and resources there. The name of our team is the Recovery Support Team. This is all of us here on the screen. We selected our name together, and I really think it reflects what we're working towards and not highlighting, the quote unquote problem. Our team's made up of a recovery support coordinator. His name's Ryan. He's been with Holyoke Medical Center for some time now and was really part of the growth of the recovery services here. He's really built a rapport with many of the treatment facilities in the community, and really part of his role, or major part of his role, is ensuring that coordination of care is seamless when somebody is being discharged from Holyoke Medical Center. We have an ongoing fantastic partnership with the Gandara Center and Hope for Holyoke, where we have 3 recovery coaches with us almost every day. They're here as well. I love their picture. They offer not only life experience, but knowledge of community resources and really a tangible example of recovery and hope. And then finally, we have a certified addictions nurse who's been really instrumental in triaging, so to speak, patients with regards to withdrawal symptoms, need for intervention, advocacy for pain management, and ongoing education and support. This is not only for patients, but for other nurses as well. She's built a fantastic rapport with other nurses. And then there's me. I feel like I play the smallest role in this, but I'll take it. I provide more of the clinical oversight, ensuring that right medications and doses are starting for someone based on the whole clinical picture. So, when somebody is medically or psychiatrically admitted, their addiction just doesn't go away, just like somebody's hypertension or diabetes doesn't just go away. We need to treat it or continue treating it while they're here. Treating someone's withdrawal symptoms with evidence-based medication seems like a no-brainer, but it's not happening in a lot of cases. And an example that always comes to mind for me is I remember about 10 years ago going to visit one of my uncles who was, hospitalized for an infection related to IV drug use. And I walked in the room and he was curled in a ball with a sheet pulled up over his head, and he just looked miserable. He felt terrible. And it was heartbreaking to see, and he ended up leaving that night against medical advice. He's okay, he's still alive, but what I'm trying to say is that image really stuck with me, and it was imprinted, and I felt helpless. And I can only imagine, the other number of nurses and clinicians who've seen patients in this same exact position and have felt like they couldn't do anything. But this is an example of something that, we're working to avoid, trying to avoid, seeing a patient and really addressing their symptoms to allow them to complete their medical treatment is really, one of our main focuses. We also realize that, not everyone wants to talk when they're feeling awful, and withdrawal is awful. And it's really challenging and in some cases impossible to move forward if we don't address it. In the month of April, my team saw about 100 patients with some sort of drug or alcohol related issue. This doesn't include patients that presented when we weren't working, or patients that we didn't know had a substance use disorder that they didn't disclose it. Every interaction with a patient we see as an opportunity to really provide compassion, education, and create connection, because this has not always been the case for many of our patients, especially in a medical setting. Leveraging the opportunity that someone's medically admitted or in the emergency room to offer and start medications for opioid use disorder is crucial. And I've been really fortunate in being able to see outcomes of people with continuing treatment for treatment for their opioid use disorder with medications following a discharge, and remaining engaged in treatment and really just improving their lives overall. I think equally as important for our entire team is recognizing that medications are not for everyone, and that providing education and having those conversations around harm reduction strategies are equally as important, including giving Narcan at the time of discharge. And this is really why our team doesn't consist of just me, and it's also why we collaborate with other community partners. So while we're not a facility where people can come and be admitted strictly for addiction treatment or treatment of their substance use disorder, we are a facility that will treat and address somebody's substance use when they're admitted here for another medical reason. And while our team is usually pretty on top of who's here and why, if you all have any patients or clients or family members that with a substance use disorder that happens to find themselves medically or psychiatrically admitted, encourage them to ask to meet with someone from the recovery support team here if they haven't already. Because I can tell you with certainty that if your loved one or client sees anyone from our team, they really will be treated with compassion. They'll always be presented with the option for treatment or recovery resources, whether it's their first time here or their 50th time. So with that, I have the honor of handing it over to, oh, this is great. I didn't know she was here. This is really looking at some of the work that we've done here. So the picture on the left is when we partnered here with the hospital, and we have a fantastic patient navigation department that does community dinners twice a month. And we gave out these kits that were used to dispose of unwanted medications, and that's Mary Jameson, one of our great community health workers up on the top right. And now I will introduce Pedro Alvarez from Tapestry Health.
Thank you, Maria. All right, so my name is Pedro Alvarez. I'm the Assistant Director for Urban Drug User Health and Outreach at Tapestry. I'm also representing Holyoke as a CAB member on the Healing Community Study. And I'll just give you a quick introduction. This is what the slide here on the services that are offered at Tapestry. So Tapestry is an umbrella of different services that are provided through a community-based organization. And services that we offer are overdose prevention and education, syringe access and disposal, referrals for further treatment care, naloxone access, birth control, STI testing, cervical and breast cancer screening, emergency contraception, HIV testing, PrEP, HIV prevention medication, breastfeeding support, food access for women, infants, and children, through our WIC offices, and then community education. So most of these services fall into our three offices that we have. Tapestry is the umbrella agency, and we have different offices that offer different services. So we have our sexual reproductive health clinics that deal with women's sexual reproductive health as far as birth control, cervical and breast cancer screening, treatment for STIs. And then we have our WIC offices that provide, women, infant, and children's food access and other resources in the community. And if you can flip over to the next slide, what we're going to focus on today in my conversation is the drug user health interventions that we do at Tapestry. So that comes in different forms. So what we have here is outreach, street and community-based. Street outreach, definitely we strap on the backpacks full of supplies and we're out there pounding the pavement. That brings us into some interesting places and some interesting conversation with some interesting folks. Then we have our community-based outreach where we reach out to different agencies, organizations, community centers, faith-based organizations as well, and provide education. We've done this throughout Holyoke, providing Narcan education, both English and Spanish as well. We have comprehensive testing services where we provide screening and counseling for HIV, Hep C, and STIs, and that definitely making referrals into treatment if something does come up positive. We have our syringe service and access and disposal programs, commonly referred to as SSPs or SAPs, syringe access or syringe service programs, and we're located throughout Western Massachusetts. So we have 5 locations that offer this service in Western Mass. So here in Holyoke, Springfield, Chicopee, Northampton, and Greenfield. And we're continuing to expand. I remember when I first started here, it was about 3 agencies, and we're up to 5. We had 6 in North Adams. Logistically, it was difficult to kind of deal with. So again, continue to expand. One thing that we do offer is overdose education and naloxone distribution. This was all these services were offered pre-COVID and pre-Healing Community Study. But what the Healing Community Study did for us at Tapestry, kind of brought these agencies together as well. We've had good working relationships with Holyoke Medical Center, Holyoke Health Center, BHN, Hope for Holyoke, but I think it has brought us closer together to reach that common goal of reducing overdoses here in the city, fatal overdoses at that. At Tapestry, we were able to hire our overdose engagement coordinator, Erica Hensel. She's not here today, but she was hired through the Healing Community Study. And what she does is focusing on 3 aspects of the work here. So the outreach, the street and community base, the syringe service, access and disposal, and the overdose education and naloxone distribution. So Erica has made her role as the overdose engagement coordinator is to be out in the community engaging with individuals. And this doesn't mean active participants or active users or active participants in our program. This is the community in general. So she's knocking on doors, she's going into businesses, inquiring if they're interested in obtaining Narcan or having a training for the staff at their location, or, talking to individuals in the community about having Narcan training for them, for their families, for their friends. If they're interested, definitely reach out. And definitely promoting that. It's about that relationship building too. I kind of mentioned it, or I kind of heard it earlier with Tammy and Maria speaking, meeting people where they're at, and it's for us, it's about building that relationship, which takes time, So definitely having Erica out there has been a benefit for us here, to provide that out in the community and have those conversations with different folks. And here, I'm trying to look at the slides here. Let me just move this out the way. So we've been, again, training individuals in Narcan, and this comes in different forms. I know there's other people on this call now interested in having a Narcan training. Please feel free to reach out. I will have my information in the chat. You guys can actually, reach out through an email, inquire about testing, inquire about Narcan education, Narcan distribution. Please feel free. And with that, I'll pass it over to Debbie.
Hi, everybody. It's such a great honor and privilege to be here representing Hope for Holyoke, which is a program of Pandara, one of the 26 Massachusetts DPH, Bureau of Substance Addiction Services, peer recovery sports centers that are funded by them in the state. And we're really just so honored to be part of many of these projects and on this great coalition. But what I'm really here to talk about is our newest intervention, which is the Highway to Hope. And it's so exciting because we really just officially launched this project last week, and this week actually are on the road. So I'm going to let you look at some of the criteria and everything, but I really want to tell a story of what happened actually yesterday at our very first ride, which is pictured here with a support group of people and someone who went out to get their first ride. So just imagine this, and it won't be hard to, because we've all been in this position as a provider or maybe someone seeking recovery. You've probably been here. Maybe that person's in front of you and they're finally ready for treatment, right? And they're ready to take their next steps in their recovery, and you've made the phone calls and you've supported them along the way, and you get them to bed, right? The bed, and maybe it's not nearby. And so, you've done all these things, and it finally has all come together and it's happened. And now they just have to get there. So you explore the, friends and family thing. Anyone can bring it? No, usually doesn't happen. And in COVID time, you may try to get that Uber or the Lyft, and that's even more difficult than it was in the past. Now that that's starting to happen again, maybe it happens and the Lyft comes or the driver comes, and we've had many stories where the person gets out to get into the car and that driver for some reason can't take that trip. Stigma. So it doesn't all work out. And one thing that if you're a person in recovery, and if you've worked with people in recovery long enough, when somebody's ready, you need to go. You need to do it now, as soon as you can, because the addiction starts talking to you when you have all that idle time and you're waiting. And we see that happen a lot. So yesterday, as I was coming in, a man was waiting for me at the door first thing in the morning, and he had a bag with him, and he was ready. And he was ready to go. We started making the phone calls, and the recovery coaches were making the phone calls, and he was like, I just want to go today. And you know what? Yesterday was a day where nobody had a bed. Everywhere around, in the local area first, nobody had a bed. And people came in, other workers, so let me call my friend here. We all have our contacts. We did it all, and we just couldn't find it. But during that time, he was talking to peers in recovery here at the center. He sat in on a morning motivation meeting. So when he was getting a little discouraged and kind of ready to give up, they encouraged him. And by the time he got out of that meeting, somebody found him a bed out in Westboro. And he was encouraged again. And then, people really supported him, and, they got ready to get him there in this ride. And he asked for a couple of people who were encouraging him, other peers in recovery, to go along with him. And they had great conversations about, other options and what you can do when you leave that program. And they talked about medication-assisted recovery, who some people had experience with there. And it was a really, supportive way to do this. And, when on his way in, everybody cheered for him. And this is like how it should go. We know that. So having transportation available to get people where they need to go is something that we've all identified as a need. And it's really a big gap in some of the steps to accessing services for people. And many times, people actually identify the fact that they want to get out of the immediate area, that they know, I hear it a lot. If I stay here, like if I stay close by, I know I'll be more likely to leave. And they need to get out of the immediate Holyoke area. And so we can do that with this project. Not only can we get them there, we can pick them back up and get them the next steps and make those connections. And we'll give them naloxone, we'll give them Narcan, and have those conversations about, the risk of overdose when you've had some abstinence, when you've been in treatment, and if anything, be able to do that. On the ride where we are providing a ride with a recovery coach, it's different than the lift or than a driver that's just coming to pick them up, and they don't have conversation. And they don't have that kind of environment where it's open to talking. And when, they may be thinking about, stop the car, I want to get out, they can have that conversation with a recovery coach. People are here in the center nodding and saying that, yes, that's true, as we know. And then they have a place to wait to while they're waiting to find that treatment bed or the next step. They could be in a quiet area, they could be getting a cup of coffee, talking to other people, and making it less likely for them to change their mind. We also will be giving them a kind of welcome bag and get ready for a treatment bag with the things that they need that peers here at the Recovery Center have identified, things that would have helped them on their journey, that would have made it a little easier. And sometimes it's just the smallest, tiniest excuse that somebody can have of why they might leave. And so we're really trying to really limit any of those things. So this man did go out to Westboro and had a very successful experience at our very first ride. And Jamie, who's coordinating the project here, is a great recovery coach. She's out right now bringing someone out to Greenfield. And we only just had what we call a soft start and didn't really publicize it much, but we will be doing that soon. And as you see the information that's on the slides here, there's some criteria that'll get out to everybody, and where they can make a referral, or people can just come right in here to Hope for Holyoke, walk in, and if they haven't secured a spot, we'll help them do that first, and then get them there in the van and be able to pick them up too. We can also provide a limited number of MOED appointments, appointments to methadone treatment if they're out of the area, or if they are missing some of their time, might have missed their transportation or couldn't get there, just to be able to provide that continuity as well. So with that, I think that it's so great to see all of the projects together, and how right from the start they can get in at any level of treatment that they need, and even be able to get somewhere that's a little outside of the area, and then get back to here to where they can continue their recovery with all these great interventions that we have today. So I thank you, and there is hope. Your journey can start today, and we will get you there. There's our tagline.
Thank you, Debbie. Thank you. Right. So now we've come to that question and answer segment of our presentation today. You know, it was good to hear a little bit. You know, I've been involved in developing these strategies with this group of great individuals here. And one thing I want to share about myself is that you know, working for the Western Mass Training Consortium, when they decided to take on this, you know, being fiscal agent for the healing community study in Holyoke, one thing that they found important is to have someone from the community, someone that was from Holyoke, and also had that experience from living. You know, and I identify as someone in long-term recovery from opiate use disorder. And one of the things that truly amazed me working with this, all these implementing organizations, is that they had folks like myself in mind. In the past, when I was struggling, some of these resources weren't available or even thought of. The stigma was real, and we're still struggling dealing with stigma associated with opiate use disorder, right? And one of the things that has been really impressive, and seeing how all these interventions kind of intersect, you know, is how they keep people like myself in mind. There has been a learning curve. It hasn't gotten to where it needs to be, but they're looking to help individuals struggling and suffering with this terrible disease. And so if there are any questions out there, please use your Q&A box, and we'll bring it back to the panelists. We really invite, you know, this time to kind of have a open dialogue. Any questions out there? Someone always told me that there's no wrong question. In fact, the answer is always no unless you ask. Right? All right, great question. So we have a question here from Lori. How are you getting the word out about all these terrific programs to the community at large? Great question. You know, we are utilizing social media. I think during these times of COVID, it's been very hard. You know, things have been shut down, but we've been able to spread the word through social media, and you know, attacking those things like stigma. Also, making sure that people know that there's medication out there to help others during these times. You know, everyone could be a first responder. I'm thinking of ad campaigns that we used in the past, you know, supporting and kind of bringing naloxone to the masses, right? You know, just saying, you know, this is a life-saving tool, and we shouldn't look down on others because they offer or have Narcan on them. This is a life-saving device and medication that can be used, and it's you know, if you're in a situation where someone, it looks like they're having overdose, even if it's not an overdose, it's safe to use. It's always a first precaution type thing. Right? So using social media, doing things like this today, having live events, and we're calling to the community at large to at the end of this, you'll see we have resource guides, we have promotional items, promotion from implementing organizations on their own. So any way we can share that, you know, utilizing the community, that's what we're trying to do.
Rafael, if I would just add from the court's perspective, again, with assistance from the Healing Community Study and student interns at UMass, we have a large, very nice posters all around the courthouse in form of our Heart Initiative. We also, I just have here, again, people who come to court, sometimes they're arrested and they're brought here the same day. But many, many people get a notice to come to court. And so we add this flyer in English and Spanish, advising them when they come to court, if they need help accessing treatment through Hope for Holyoke or Holyoke Medical Center, et cetera, all they have to do is ask. So we're doing our best to get that word out. I've been doing trainings with the lawyers who are often appointed to represent people, encouraging them, again, putting the emphasis on immediate access to treatment first day they come to court. So we're all working on that as well here.
Thank you, Judge. Thank you, Judge, for giving us that. Does anyone else want to answer the question on how?
Yeah, we've had extensive ad campaign. I don't know if anybody's been around Holyoke and seen some of the ads that are posted here on this slide now. We've been had ad on the PVTA, public transportation, at the Holyoke Mall. I believe there was a picture in one of the slides earlier with Maria standing with the virtual picture at the Holyoke Mall. We've had banners, we've had posters kind of posted up at, wherever we can put them up. Word of mouth, definitely. Eddie Cases, heads our communication stuff. He does a good job of networking, having his Holyoke Safe Neighborhood Initiative, using that email blast. But definitely word of mouth and getting the word out there. I know Erica, as our overdose engagement coordinator, spends a lot of time in the community. And again, just having conversations with community members. So definitely word of mouth as well.
Yeah, thank you. Does anyone else have anything to offer before we move on to our next question?
I think on behavioral health side, we've been, using similar strategies for marketing, getting the word out, word of mouth. We're going to be adding some billboards in the Holyoke community in that neighborhood where our clinic is on Maple Street, and then also social media and word of mouth, flyers, brochures, appointment cards, things of that nature, having our information over at the Holyoke Health Center so we can cross-refer across both agencies.
Awesome. So we also have a question here that's transportation related. It says, I'm really excited about the transportation services that Hope for Holyoke will be offering. Such a huge unmet need. Can you say more about the availability, hours, number of drivers, etc.?
Yes, thank you. So we currently have recovery coach drivers available from 10 to 5, and soon we will be adding a per diem, a couple of per diem people who will be covering from 6 to 10 and weekends. So we can take requests during all of those times. Right now, because we're just kind of ramping up, we're just starting a little bit slower. So doing the 10 to 5. And I anticipate in the next 2 weeks, we'll have a couple other people coming on board to add the per diem so that we can do some rides in the evening and on the weekends as well. And just a quick reminder, and there'll be some more specific data coming out about the referral, and you can go onto the 413 cares findhelp.org in that process when we have that up, or you can just call in or come in. But the things to remember are just that this is for Holyoke residents or people that are tied to Holyoke community in some way, and that they have an opioid use disorder or maybe at risk of that, and then that they're going to or from treatment or medication-assisted recovery. So kind of some just quick things to think about as far as eligibility. I hope that answers your question. Thank you.
Just we also have another question for Hope for Holyoke. Where is Hope for Holyoke as far as group sessions, store donations, etc., since things are opening back up?
Yeah, thank you. We're now open full-time again, and we are accepting donations again for our Hope Boutique, which many people know about is a incentive program that offers new and used clothing and household goods and personal items. And we give Hope Dollars as an incentive when people do things related to their recovery. So we will take those again, and we're open 9 to 5 every day now during the week, and have just opened back up Saturdays just from 10 to 12, and have 2 nights that we are offering. One night, Monday night, Celebrate Recovery is on again until 7. And I'm proud to say the Spanish Narcotics Anonymous meeting is being held again, the only one in the area, on Friday nights from 7 to 8:30. So, and we'll continue to keep ramping up our hours to get really back to full a couple more nights and weekends. We do have a limit as to how many people can come in, but we're able to spread it out in different rooms so that if we reach capacity in a particular group, we can open up another. And we do a lot of hybrid groups too, so people can still join in on Zoom and be in the live group, and we can even put them in another area to join in if that's too full with regards to safe social distancing. But we're fully open, so thank you.
That's great to hear. As we're waiting for more questions, and something came to mind, and I'll turn this question over to Rose Evans. How can someone that is looking for treatment kind of come into the HN City Clinic?
Okay, so for walk-ins, we right now are taking walk-ins from 6 a.m. until 8 a.m. Monday, Wednesday, Friday. But any day of the week, someone could stop in to inquire about services and explore what type of treatment they might be interested in. But our primary hours for walk-ins, like I said, is Monday, Wednesday, Friday, 6 a.m. to 8 a.m. But someone is there 7 days a week. Okay? And if
Yeah.
it's an emergency, of course, we'll address that emergency immediately. Okay?
Thank you.
Yep.
Also, does anyone else on our panel, Pedro comes to mind? If someone, I know the brick and mortar site in Holyoke has been open. Do you want to talk more in detail?
Yeah, definitely. So Tapestry, we're located at 15A Main Street. Right when COVID hit, right before COVID hit, we were already planning our move. So the lease was kind of up and we had to move during COVID. But our doors never closed. We're located at 306 Ray Street right now on the corner of Race and Cabot, right on the first floor. We're open Monday through Friday, 8 to 4. On Fridays, we're open a little later, just because of the weekend. We want to make sure we see people that might work till 4 o'clock and can't make it to our site. So we're open till about 7 o'clock. We focus on outreach a lot on those days, especially making sure we see people because we're not open during the weekend. So making sure we see people before that weekend kind of actually hits, make sure they have their supplies, make sure they're equipped with Narcan when we're answering any other questions that they might have. But definitely come check us out. Come check out our site. Come check out our website. I put my email in the chat. Individuals have any more questions or want to inquire about Narcan trainings or Narcan distribution, all our services are free of charge. We do come in and provide in-person trainings. I know some people might be uncomfortable with that right now because of COVID. We do offer it in a Zoom platform as well. We do have Spanish-speaking staff on board, so we provide the trainings in Spanish as well. And like I said, it's everything that we do here is on a code-based system, so individuals don't feel the need to give their ID or give their whole full name up because they might feel uncomfortable. Just come in, have a conversation with one of our harm reduction counselors. It's great to know the people here, get to know a little bit about what we actually do here, and equip yourself with a Narcan kit. Even if it's not for you, it might be for somebody else. Feel free to give it out. Feel free if you work with someone or know someone personally, send them down to our site, and have conversations with us. We do a good job of humanizing the whole piece, so people, we talk about stigma and everything, and it's a stigma-free zone here. We try not to judge people. It could be easily anybody else walking us through that door, so we keep that in mind here. So definitely 306 Ray Street, Monday through Friday, 8 to 4. Come see us. Come check us out. We're here.
Thank you, Pedro.
Raphael, I
Yes.
just want to add that BHN's clinic is at 235 Maple Street. So it's directly across the street from Holyoke Health Center. So again, 235 Maple Street.
Thank you, Rose.
Yeah, sorry about that. Yeah.
No problem. And it brings me, speaking of the Holyoke Health Center, Tammy, if someone is interested in receiving services at the Holyoke Health Center, what should they do?
There's a couple of things that they can do. We take walk-ins during our working hours between 8:30 and 4:30. So they can come in that way. We're located at 230 Maple Street in Holyoke. And they can just ask for the Center of Recovery and Support, or say that they're interested in medications for opioid use disorder, and people will send them our way. People can also call us directly. We have a direct line, 420-1730, that gets people directly to our receptionist, and she can connect that person directly with one of our members on our team to help get connected to care. And that's the best way. If they don't have insurance, we can help them get connected to insurance. We can get them connected to other services as well if they want. That's a few different options. If people are not able to come in for whatever reason due to transportation issues, or they live far away and they just aren't able to get in, we can offer our visits through telehealth as well, which is a really big thing that started happening during COVID and has actually worked out really well for a lot of our members. And we're still hoping to continue that moving forward because it's working out so well for people who have work, childcare, don't have transportation. Getting to the health center pretty frequently can be sometimes a barrier. So offering telehealth has been really great.
Yeah, thank you for that. So another question came in, and this one is for BHN City Clinic, and it's just expanding on something you probably already said, Rose. But what is the process at the clinic at BHN? Is there a waiting list, or you spoke about the walk-in process?
Right. We don't currently have a wait list at the clinic. Walk-in again is Monday through Friday from 6 a.m. to 8 a.m. And then our dosing hours for our patients is 5:45 a.m. to 12 noon, Monday through Friday. And then 7 a.m. to 10 a.m. on Saturday and Sunday.
Thank you, Rose.
And our phone number, if anyone wants to jot it down, is 413-532-0389, option 4. Again, the phone number is 413-532-0389, option 4. There's no wait list.
Thank you.
Okay.
All right. So we do have a couple more minutes for questions and answers.
Raphael, if I could jump in for just
Yes, go ahead.
I see someone had asked Debbie what kind of case a person would need to have to be eligible for participation in our HEART initiative. There is no limitation on that. Anyone who has a case, any kind of case, pending in the Holyoke District Court can come in and speak with, again, a person here, get connected to a recovery coach, get connected to an assessment, a treatment plan, using the RIDE program, get a ride if it's somewhere other than, say, Holyoke Health Center. So that's open to everyone. Our other more formal programs are controlled by statute. Chapter 111E deals with any kind of drug offense short of possession to distribute or distribution of drugs. And then another program basically for people who have no prior convictions for diversion into treatment, job training, etc. those are things probably need to talk to the court about or a lawyer about. But the HEART initiative is open to anybody who has a case, any kind of case, anytime they come to court. And the goal, again, as was said earlier, even if it's not the first appearance, doesn't have to be the first time. Someone comes in for a pretrial conference, someone comes in and they think today is a day I want help. All they have to do is ask. Any case, any day.
Thank you for that, Judge, for that clarification. You know, I have been very impressed. You know, someone that has lived experience. You know, the court wasn't that place that I would kind of imagine these kind of services would be available, but they were so needed in my time. So I really appreciate what you and the court is doing in Holyoke and trying to, you know, achieve this goal in reducing opiate use overdoses, deaths.
We appreciate all the help you've given us. We really do. Thank you.
We have a question here. What are the current and recent epidemiologic patterns of opiate and other overdoses in Holyoke, including heartbreaking overdose deaths? I'm pretty sure I really didn't say that word quite well. So does anyone want to take on that question? What are the current and recent epidemiologic patterns of opioid and other overdoses in Holyoke, including heartbreak overdose deaths?
I could just point them in the right direction. So all of that information is available on the Massachusetts Department of Public Health website under BSAS, and you can see it by city. The way that it works, though, the way that the data works, though, is that it's a little bit delayed to current data. And so the data that you'll see in there is, I think, up to date until 2019. And then, so we should be seeing more data come in as the year goes on. There may be some stuff from early 2020 that's moving into there right now. But if you search opioid overdose deaths or just overdose deaths, Massachusetts by city, it'll pop up a PDF and you can see it by city and also by state. So that's where the most recent data from the state lives. However, the CDC is tracking other reportable deaths too. And so their data is up to date within the last year. And they're up to 87,000 deaths overall in the country, which is the highest that it's ever been. So, and just kind of anecdotally, what we're seeing in terms of trends in the last year is that, I don't know if anybody saw it, but there was a report that came out from Massachusetts that said opioid deaths had gone down last year. But in fact, the actual data was looking at overall deaths, and what they were seeing was that there was also a 100% increase in opioid overdose deaths amongst Latinos and African Americans. And so I just want to, you know, we're aware of the equity situation with access to treatment, and that's something that the HEAL study in Holyoke is really focusing on, making sure that everybody has access to culturally competent treatment. And so, you know, that's why we are doing all the work that we're doing in this community. It's really important. But the data most up to date from the state is on their website.
Tammy, the report that you're referring to, if I remember correctly, indicated that opioid deaths had, overdose deaths had gone down slightly across the Commonwealth, but had gone up in Holyoke and Springfield. So others probably know better than I do, but I think that's correct. Again, it might be a little bit lagging, but that was before this effort took place, that was what was happening, I believe.
Yeah, and that is true, Judge. In 2019, even though all overdose deaths uh, kind of diminished by 50%. The reality is within the marginalized communities and Hispanics and Latinx folks, it actually increased by 63%. So, that's why it's so important to, have these services in Holyoke, because these are our people. We make up 54% of the population in Holyoke. And so we're trying to mitigate as many of these tragedies as we can. And the importance of this important work cannot be underscored by the least. We are trying to reach these folks as best as we can, and we need your help to do it. We have more of a comment that was given. I just want to say how incredible this panel is. You are doing amazing things for our community. Kudos to you all, and thank you.
Thank you.
Thank you.
Okay.
All right. So that brings us, summarizing what all this is, right? This panel is composed of organizations kind of hitting all the things and these evidence-based practices that are proven to work and working together, right? To kind of meet the same goal of reducing opioid related deaths. We got the medication for opioid use disorder, which is Holyoke Medical Center, Holyoke Behavioral Health Network, City Clinic, Holyoke Health Center, Highway to Hope, using the peer transportation model and getting folks to these necessary services. The HEART program at the Holyoke District Court, which is, directly providing same-day treatment if people choose to. Opioid overdose education and naloxone distribution with Tapestry Health with the harm reduction specialist, naloxone promotion via syringe sales at the Holyoke Health Center Pharmacy, where if someone goes and is going to purchase this, we're reminding them, hey, have you heard about Narcan or naloxone? Placement of nalox boxes through the city. We're currently looking for public spaces and private businesses that want to incorporate nalox boxes to kind of help and have this available, just the same as a defibrillator in case of emergencies, right? And safer opioid prescribing, working with providers to kind of make sure those people that are high risk receive a prescription for Narcan, and promotion of mixed app and scope pain for our providers, and getting those tools necessary to provide these services in a cultural appropriate way. And promotion of a DEA drug take back day that happens yearly, twice a year in October and April. So just to show you here, these are going to be available. So if you can reach out to us, we can make these brochures available, have them delivered somehow. This gives us, a list of our community partners, some supports needed, and some language to kind of help guide conversations if you have someone in need of these services, highlighting everything from, our organizations that are working closely implementing orgs, but also, providing supports. People might not be ready, but need to speak to somebody. And just having places like the Wildflower Alliance for people to go to and be able to kind of come into a judgment-free place and be able to be themselves until they make those decisions that they need to make. How can we stay connected, right? we're going to be sending out these slides. You know, we would like your feedback, right? Let us know how we're doing, what we did. Promote resources and services available in Holyoke. These are the things that we need the community of Holyoke to kind of jump on the same boat with us and kind of get these messages out there to our broader community. You know, distributing resource guides. If you want to know more about HEAL and what it's doing in Holyoke, visit our website. You know, like our Facebook page, share. We put out ads weekly, information out there weekly. You know, advertising services, trainings. Like our page, share it. That's how we're gonna reach the masses in Holyoke and get this information out there. And like always, if you need to contact me, here's my email address, and you can reach Amani, which is our community engagement facilitator, as well at HEAL, bmc.org. And so, thank you, and for being here today, and you know, being here to hear us talk about all these wonderful strategies that we co-created and worked so hard on. I want to thank the panelists here today for speaking on behalf of your organizations and the great work that you're doing. And thank you all. So thank you for your time, and have a good rest of your day.